We are live.
Very good evening to all of you. I'm Sayuka, your host for today's live from All About Skin Allergy team. I'm sure all of you will be keeping good health. Today we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the causes unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it's a boon or blessing if we can get to hear from an and its types, how we can prevent it, kind of tests required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Kumar Prateek, live from Bhagwan Mahavir Medica, Super Specialty Hospital, Ranchi, who will educate us more about urticaria and its management. Dr. Kumar Prateek is MBBS, MD in Dermatology, Venereology, and Cosmetology, is currently practicing as a dermatologist, trichologist, cosmetologist, and sexually transmitted disease expert in Ranchi. A very warm welcome to you, Dr. Prateek. Hope you're having a good day, sir.
Very good evening to all my colleagues and listeners here. Thank you. Thank you for the brief introduction. Hello, everyone. I'm Dr. Kumar Prateek. I'm presently working as a consultant dermatologist and trichologist at Bhagwan Mahavir Medica Super Specialty Hospital, Ranchi. So today we are going to talk about allergy. That is a very common known term, which you must have heard from a lot of people, that I'm allergic to such and such substance. I'm allergic to this type of food, certain type of dress, to this climatic conditions. So we'll have a brief discussion about allergy today.
Definitely, doctor. And as we are going to talk about urticaria, first, we would like to know what it is, what this word stands for.
See, as per a dermatologist's point of view, allergy is a type of a condition in which there are very rashes in the body. These rashes are these rashes are generally red in color, can appear in any part of the body. They are often accompanied by transient, well-circumscribed lesions, which in Hindi is often patient says कि मुझे पित्ती हो गई है या जलपित्ती हो गई है या rashes आ रहे हैं. So they present transient. Transient means they are temporary for a short period of time, say less than 24 hours. These rashes can involve any part of the body, even the lips, the periorbital region, in your respiratory tract. There are sometimes patients can present with swollen lips, that is angioedema, respiratory difficulty, when it gets very worse. Actually, allergy
so now we know what urticaria is. Yes, doctor.
Allergy is a broad term when a body is not able to cope up with any form of an allergen or stress. So that encompasses a pattern that is known as allergy.
Right. And specifically, as we are talking about urticaria, what are the main causes of it? What causes urticaria?
The urticaria is a huge classification that we have the ordinary urticaria, among which are the physical, chemical, and other ones. We have contact urticaria, we have angioedema. But what is the cause of allergy or urticaria varies in every person. Some people are allergic to certain types of food, like say cucumber. You might have heard say patients have something like that. Citrus fruit, they are allergic to it. Some patients to specific drugs like penicillins, ibuprofen, painkillers. There are other foods which have preservatives like sodium benzoate, which is a very commonly used preservative. Such many patients are allergic to it. Some patients are prone to develop allergy if there are sudden or drastic changes in temperature suddenly, like there is cold urticaria, there is solar urticaria, and there are many other conditions like bee sting, a wasp sting, certain clothing. If there is a sudden change in altitude, also that also can be a form of an allergy. So there is a very wide spectrum. I always say to my patients who present with allergy that in this case you are the best doctor. You know better than me what you are allergic to. You should maintain a diary, note down what symptoms, scenario, experiencing these symptoms and all.
Right. So these are the causes, the main causes we can say of urticaria. Doctor, we would also like to know how does urticaria looks like? And as you have already mentioned, it's a kind of allergy. So when should we get alarmed that, okay, maybe it's urticaria and we should go and consult the doctor?
Yeah, see, like I said, whenever there a patient present with rashes, a sudden appearance of any lesions in the body, and when there were no pre-existing lesions, patient may have respiratory distress, swelling of lips, and periorbital swelling, difficult breathing, any type of transient swelling. When patient presents with such symptoms, rashes, along with these rashes, there is burning, itching, stinging sensation, then a person can assume he's suffering from a sort of an allergy, and he or she should consult the nearest dermatologist.
Right. So, this is how urticaria may look like and when you should be alarmed and consult a doctor. We would also like to know, doctor, how serious this problem is, how serious this disease is.
Uh, Allergy is mostly not very severe in most of the individuals. Mostly the individuals present with these transient swellings, which we known as wheals or red rashes that are itchy, stinging, with specific treatment or with antihistaminics for a short period of time, they generally subside. Some patients they with such lesions for a very long period of time, which we classify as chronic urticaria. Chronic urticaria, by definition, is persistence of lesions, such lesions beyond 6 weeks of time. If these patients can present with such lesions, which can be associated with pain, sometimes with fever, respiratory distress, swelling of lips, so we can classify these patients as chronic urticaria. Such patients should refer to a dermatologist and should be investigated deeply as to know the root cause of the urticaria or allergy there.
इसको बाहर रखना है इसको बाहर
Yes, so now,
I'm not able to hear you. You're not audible to me.
yes.
You're still not audible.
Okay, and now I think I'm sure I'm audible to you.
Yeah, yeah.
I'm sorry, there was some technical glitch. So now, as we know that how serious urticaria is as a disease, we would also like to know what are chronic urticaria hives. How will they go away? What's the way?
See, well, like I told that such patients need a detailed investigation. When such patients come to us, we give time to them. We have a detailed history as to what triggers it. All my the patients which present with urticaria, I ask them personally to maintain a diary. When did your last urticarial lesions appear? What was the timing? How much did they persist? Do you think any factor aggravated it? Any clothing, any food, any dust, or any medications or something? So we ask the patient for a complete history. We get all the necessary blood investigations done. Most in approximately 14 to 15% of the patients, we find they have thyroid autoimmunity, that antibodies against TSH or something. So we treat the necessary hypothyroidism, and the urticaria gets treated. So it's a very huge spectrum. First, it's a detailed history from the patient side, their eating habit, fooding habits, their daily routine or something. We get the blood investigations done on our part, the necessary blood investigations like the liver function test, renal function test, complete blood count. We sometimes have a look on the peripheral blood smear also. We often get the serum Ig done. So it's a huge spectrum. Sometimes we do need to get the serum sickness test done, complement levels, which we do in the later part.
Okay. Right. Doctor, we would also like to know that what complications may arise or what are the potential complications of urticaria if left untreated? What may happen?
Yeah, that's a very relevant question in the Indian patients, because most of the patients tend to treat themselves. See, scabies can also present like urticaria. Eczema can also present like urticaria. There are many conditions in dermatology which can present like urticaria. So the patients have a tendency to treat themselves. First is refer to a dermatologist, let him or her make the diagnosis. No self-medications, no over-the-counter medications. And what about the complications which you asked us? Like I said, there can be periorbital swelling, swelling of the lips, which is known as angioedema. There can be respiratory difficulties. The most important thing which urticaria does, it affects the lifestyle of the patient. The patient is constantly itching. He may have a very bad lifestyle, which is hampered socially. He may not socialize well. He may refrain from going out or social gatherings or something. So he may also develop a bit of social stigma also due to this chronic and persistent itching. So the best is you get treated, come to a dermatologist, have a talk with him, get necessarily investigated. We can proceed from there.
Right. So it's important to consult your dermatologist at the earliest because, when you delay, for example, you start having rashes and you'll think that maybe it will go away with time or maybe some home remedies will work. Don't do that. Don't go for over-the-counter medicines or creams, etc. Please consult your dermatologist at the earliest. Doctor, I would also like to ask you, can stress cause urticaria? And if yes, then how do stress urticaria looks like?
Stress urticaria will present like other urticarias itself. There will be no distinctive clinical changes or clinical findings. In such cases, yes, to the first part of the question, yes, stress can precipitate urticaria. Like if the urticaria is due to some other cause, it can aggravate it. Sure, yes. And stress is itself a reason or an etiology for urticaria. That is also right. And there are no clinical differences in other forms of urticaria, generally.
Mm-hmm.
So if stress precipitates urticaria, there is a common notion that the mental stress is a form of stress. No, I always say to my patients, the stress can be physical, it can be chemical, it can be emotional. There are huge forms of stress. If you are going outside in the sunlight, it can be a stress without sunscreen. That is a form of a stress. So it's an insult to the skin, it's an insult to the your outer epidermal layers. So it can precipitate urticaria.
Right. So even stress, and as doctor have very rightly said, there are various types of stress. So any of it or a combination may, cause urticaria. And but if I think it's also a vicious circle because stress can lead to urticaria. Urticaria, again, as you have already mentioned, apart from all the other physical problems, it's a social stigma. People hesitate to go out in public. Again, that leads to stress. So that vicious circle is there. So it's better to break it. And the only way to break it is to go and consult your doctor, a dermatologist in this case. I would also like to know that why do hives or urticaria get worse at night? We have seen, people who have this issue that at night they just exaggerate.
Yeah, see, if like I forgot to mention a few points, the etiology of urticaria, actually, there are many infections also which present with urticarial lesions. One is the H. pylori infection. Yeah, if you have an infection in the bowel also, it can precipitate like that. If you have UTI, that is urinary tract infection. Scabies can also present with urticaria. So scabies, we all know that the mite is nocturnal, it comes out of the burrow at the night. So in that case, the urticaria will be predominantly in the night. So there are some forms of urticaria which get aggravated during the night or in the nocturnal period.
Mm-hmm.
And this also has partly been related to the levels of the ACTH and the cortisol, which tend to differ in the morning and in the evening. So that can also be a potential cause for aggravation of some forms of urticaria in the evening.
Right. So, doctor, whenever we have some kind of allergy, especially with skin allergies, we have this, notion that I'll get a skin allergy from the other person. I may get it. So, how contagious is urticaria? Is it contagious at all?
Absolutely no. Urticaria is absolutely not contagious. Yes, the infections. So there are some infections, some mites, some infectious agents which harbor on the skin. They can be transferred to other patients, to other people who are living in close contact with the individual or the patient there. But urticaria as such is not contagious. The lesions of urticaria, the wheals, the hives, as you say, they are not contagious at all.
Okay, so I think it's important to also understand that as it is not contagious, please don't have those notions in your mind because it may actually affect the psychology of the person who's actually suffering from it. So the best way to help a patient is to let him go and consult a doctor. I think that's important. So if he or she is hesitating, please help him to go and reach the dermatologist at the earliest. Doctor, I would also like to understand that we know that in the last 2.5 years, COVID, what we call, what we address as COVID era, a lot of people have complained about hives on face. Anything to do with the urticaria?
Yeah, that is a very relevant question in this COVID era. See, I personally have encountered, I've seen so many patients during the COVID era who have presented with urticaria-like lesions all over the body when they were infected with COVID-19 virus. Recently, I had 2 patients who predominantly presented with urticarial lesions. Thereafter a couple of days, they presented with fever and joint pain, which we further investigated. They turned out to be COVID positive. So yes, there were definitely well subset of patients. I would not say all the patients, but 30% of the patients present with urticarial lesions, especially over the face. A part of them, I would say rather 20 or 10% of the patients presented with angioedema also, like respiratory difficulty, swelling of the lip.
Mm-hmm. Yes. So these are the problems that may occur. And again, the solution is just one, don't waste your time. Don't just waste your time sitting at home or thinking that it will go away with time. Please go and consult your dermatologist. Doctor, one more thing, we often say that our skin is what we eat and our health is directly associated with what we take in. Is there any dietary precautions or do's and don'ts for the patients of urticaria? If they'll eat or consume something, it may aggravate their issue?
Yeah, sure. You might have heard a lot of people saying, see, I'm allergic to dairy products.
Yes.
I'm allergic to cheese. I'm allergic to yogurt. I'm allergic to butter. I'm allergic to milk. I'm allergic to paneer or something like that. So I ask the patient, if you are allergic to it, stop it. Just you can avoid that food or foods related to it. The best is, like I said before, maintain a diary. When did you have the urticarial lesions? How much time did they uh, persist for? Sorry, and the number of times that is get repeated. There are certain foods in which there are preservatives like the sodium benzoate, which is a class C preservative. So many people are allergic to it. Many people are allergic to green chilies, even cucumber. Some are allergic to lychees and all. So I always say that the patient is the best doctor in such a scenario. You know you are allergic to it, just avoid it.
Right. I think it's a piece of wisdom by a doctor that, if you're allergic to something, why go for it? Leave it. That's important. You are the best, you know yourself best, you know your body best. Just listen to your body. That's very important. At times becomes really necessary to listen to your own body, what your body is trying to say. Doctor, I'll also pick few of our viewers' question. Many viewers are
Sure,
here.
sure.
Tripti Pandey is asking, how serious is urticaria and is urticaria lifelong?
The first part of the question, how serious is urticaria? Urticaria is generally not serious in most of the circumstances. But I'll say it again. If your urticaria or allergy presents with swelling of the lips, respiratory difficulty, or swelling in the periorbital region, you should immediately refer to a dermatologist. These can be life-threatening, and you should get it treated as soon as possible. And is urticaria lifelong? See, that depends on what type of urticaria you are having. If you are allergic to foods, drugs, you can just avoid it. So if you will have those foods or ingest those foods, only then you'll have urticaria. Like if your urticaria is due to some sort of clothing or fabric, you can avoid it. So when you are exposed to that allergen, you will have urticarial lesions. If you are not exposed, you won't have.
Right. So whether it's lifelong or not, that depends upon, on the type of urticaria that a person is having. Akanksha Jan doctor is asking, is urticaria a fungal infection? Because many a times we hear about skin, whenever we hear about skin infection, we say it's fungal.
No. Urticaria, see, fungal infection can present as urticaria sometimes.
Okay.
But urticaria is definitely not a fungal infection. So it's not vice versa. Fungal infection can present like urticaria, but urticaria is not fungal infection.
Okay, right. But, as a layman, viewers, you won't know whether it's a fungal infection or it's urticaria.
Exactly.
Please go and consult your dermatologist. Don't be a doctor yourself. That's what we are, continuously telling you. Avantika Shinde is here, doctor, asking that I want to ask which tests are available for inhaled allergens.
The inhaled allergens, generally these allergens present with a very severe form of urticaria. So we have to go for the routine blood test. Even we have to take help of the radiology. We can go for the imaging also. And we have ASST and other CAP-like tests. So this is a huge spectrum, and it has to be discussed in a very detailed form.
Sonia Iyer is here, doctor, asking, so what is the best treatment for skin allergy?
The first, as a dermatologist, I look for why are you having an allergy? I look for the cause. As a patient, I'll tell you avoid it. And if you're not able to, there are some cases we are not able to find the cause of the even detailed investigation. We classify them as chronic idiopathic urticaria. Then in that case, we'll give you medications like antihistaminics. We have a huge armamentarium of drugs. If that is not going to work, we'll give you steroids. There are other immunosuppressants like cyclosporins, micropentol, IVIG, plasmapheresis. It's a huge armamentarium.
Right. And again, we would like to, tell you viewers that please don't go and buy anything over the counter to just, make the problem go away. It won't go away. It will just make it worse. So please don't do that. Krella Valley Howard is here, doctor, asking what will make my rash feel better? Will it go away?
Yeah, I'll answer the second part of the question. Yes, your rash will definitely go away. Mm-hmm. And your dermatologist will make you feel better for that. He will look for the cause. He will find it and investigate you, have a detailed history with you, and let you know. We'll try to find out what's the cause, and we'll definitely treat you, give you drugs, and in that case, try and solve your problem.
Yes, so Krellavelle, if you want to get rid of rashes or whatever, skill-related problems you are having, please go and consult your dermatologist. Don't wait that, some medicine or some home remedy will actually cure you. It won't, it will just make it bad. Please go and consult your dermatologist. Rahul Roy, again, on the same lines as, our previous viewer, is, his question is, sir, what is the medicine for skin allergy?
Like I said, first we'll look for the cause, get you investigated. Medicines, we have the second generation antihistaminics, we have steroids, we have immunosuppressant, and a huge armamentarium, like I said before. So we will definitely treat you, but we'll first look for the cause. We'll try and avoid it as much as possible.
Right. And another question by Nisha Sharma, a viewer asking, what's causing my skin allergy?
Yeah, definitely. Like I said before, if we'll look for the cause, we'll have a detailed talk with the patient, get necessarily investigated. If necessary, we'll go for higher investigation like ASST, radiological imaging, and then we can find out what's causing this allergy.
Yes. Harish Kumar is asking, what is the treatment of cholinergic?
Cholinergic urticaria.
Cholinergic, yeah, right, urticaria.
If you have been thoroughly assessed and you have been diagnosed by a dermatologist as cholinergic urticaria, you must be knowing that sweat is precipitating your urticaria. So in such patients, we generally advise lifestyle changes like putting on a sunscreen before going out and avoiding extreme of temperatures and practicing yoga. If these do not solve the problem, we go for antihistaminics. Doxepin works good here. If that also does not control the chronic urticaria, we can go for higher drugs.
Right. But only a doctor can, prescribe this, right, doctor? Exactly. I mean, they should just not go and start getting those by watching a video on YouTube or going influenced by any influencer on the social media. What's your take on that, doctor?
Yeah, sure. You should always consult your dermatologist. Let him or her arrive to a diagnosis, and you will be treated accordingly for it.
Okay. Priya Sharma is here asking, my stomach starts hurting after eating jackfruit as a vegetable. Is it allergy or something else?
First, I'll look for, has the jackfruit been well cooked? First question is. Okay. Because many people have cramps or I would say a slight bit of discomfort after eating jackfruit, which needs to be boiled and cooked for a longer period of time than other vegetables. If it's true allergy, you will experience abdominal cramps, even sometimes loose stools or vomiting, and it can also present with urticarial lesions or rashes, like I said before. So this will be needs to be thoroughly investigated by a dermatologist, and we may also need help of a gastroenterologist here if there is true jackfruit or fruit vegetable allergy.
Okay. Akshay Ajit is here asking which food is not allowed in urticaria. I think again we have already addressed this, but still, doctor, your take, which food is not allowed in urticaria?
See, like I said before, if you know you are allergic to that food, just avoid it. Mm-hmm. There are many patients who are allergic to, like I said, preservatives like dairy products, preservatives like sodium benzoate, dairy products like cheese, paneer, milk, yogurt. So just avoid it.
Right. Soumya Sharma is here asking a question which I'm sure many of our viewers have in their mind, and that's how can I reduce urticaria naturally? Is there any way?
One method which will help reduce urticaria naturally to some extent is regular yoga and deep breathing exercises. And before that, first is avoid it. If you know what triggers it, just avoid it.
Okay. So I think the bottom line is that if something is triggering any discomfort in you or any, the skin allergy you are getting, please avoid it. At the first stage, then of course you can go and consult your doctor and find out what are what the diagnosis say. Doctor, one more question. Can children or kids get this issue?
Yeah, there are many children, mostly these infections which I had talked about a few minutes ago. The infections in children mostly present as urticaria. So there is always a diagnostic challenge in such patients, in pediatric patients, because mostly the infection, any sort of infection like scabies or any parasitic infection, any other abdominal infection, they can present like urticaria. So yes, a child needs to be thoroughly investigated.
Okay. Megha Sharma is here asking, what is the strongest medicine to stop itching?
There are many medicines to stop itching. There is always a step ladder pattern in medical science. You do not start with the most powerful agent at one go. You start with the lowest possible agent. See if the patient's symptoms have gone, patient is relieved. If that does not happen, we move to the next step. That does not happen, we move to the next drug. So it is a step ladder pattern. Medical science is a step ladder pattern. We do not start with the highest and the most potent drug in the first.
Right. And only a doctor can, prescribe or suggest medicines to you. So even if the doctor would tell you that what is the strongest medicine available for relieving, itching, it may work as a general knowledge answer for you, but otherwise for your skin allergies, for your rashes, for your urticaria, that's not going to work.
Even that is not possible to pick a specific agent because urticaria differs, the cause differs, the prognosis differs, the features differ. So you cannot pick a single agent that this is the best agent to stop it.
A lot of viewers are asking this question, so I'll take it as a accumulated question. The question is that what are the lab tests that are needed, and why are those lab tests needed when a person having some allergy or maybe urticaria comes to the dermatologist?
Yeah, like I said, I had mentioned a brief point that during these investigations for allergy, I have found personally that, like said, 10 to 20% of the patients have presented with hypothyroidism or hyperthyroidism. So that is a chance event. And when we have the physician treats him for hypothyroidism or hyperthyroidism, the urticaria also goes. So what I'm saying is that this urticaria, which seemingly seems a very trivial thing, is sometimes can be very challenging to detect. So we need a large number of tests to arrive at the diagnosis, not always, but sometimes. So we get the complete blood count done, liver function test, the kidney function test, the serum IG, sometimes ASST and CAP tests, and other TSH, the thyroid profile. Even what I have found is that sometimes patients were unaware that they are diabetic. Their uncontrolled diabetes has triggered some form of allergy or an urticaria-like presentation. So yes, they need a detailed investigation.
Right. So detailed investigation is important. It's needed. And when you go and consult your dermatologist, they'll, ask you to get one. Sohail Khan is here, doctor, asking, do I have an underlying medical condition? I think it's a very vague question. But yes, what will you suggest?
Like we will look for the cause. We will get you thoroughly investigated as to what is causing the urticaria. So is I think he must be asking that is allergy. Does any sort of allergy mean that I am immunodeficient? No, that does not mean that. Your immunity is good. First thing first. And we will get you investigated that why urticarial lesions are presenting, why do you have urticaria so frequently. So that needs detailed investigation.
Yes, so again, detailed investigation is required, and when you'll go consult your doctor, they'll definitely ask you for, do some tests, etc. And that's how they'll diagnose the whole issue. Doctor, again, many questions are also, again, asking, many viewers are also asking this question again, that what are the treatment options available for urticaria? So we would like you to throw some light on that again.
Yeah, exactly. Like I said before, first, the cause. We will look for the cause. Why is it happening? How many times does it happen? How bad is it affecting your lifestyle? How bad is it? Are you having any respiratory difficulty, any lip swelling, any other problems with urticarial lesions? Then we can start the treatment pattern. So we start with the antihistaminic. The antihistaminics are of two types: the non-sedative ones and the sedative ones. The new ones are non-sedative. That means they do not sleepiness, do not cause sleepiness or something like that. If patients do not respond to antihistaminics, we can go to oral steroids. If the patient does not want steroids, we can go to other immunosuppressants like tacrolimus, mycophenolate, cyclosporin. Even if that is not working, we can go to plasmapheresis or intravenous immunoglobulins. But that is the last resort. So, like I said before, medical science is not like something I'll start with the most potent drug. No, we'll go slow, we'll go steady, and we'll go according to the patient.
Right, and slow and steady wins the race, we all know. So that's the SOP that's adopted. Rahul Yadav is here, doctor, asking what is the most common cause of chronic hives?
Exactly. See, if you are having these urticarial lesions for greater than 6 weeks, we classify this as chronic urticaria. So these patients, in such patients, we look for the cause. Like why is it the food history, the medication history, any allergen, any dust or any other particles like pollen, household allergen, household dust or outside dust. What is causing? We'll look for the cause. If we're not able to find the cause, even after detailed investigation, we classify this as chronic idiopathic urticaria. And we put the patients on antihistaminics and the other necessary drugs after getting him or her thoroughly investigated.
Right. I'm sure, Rahul, you have your answer now. Swati Sharma is here asking, a rash can be caused by a skin irritation?
Yeah, sure. Surely it can be caused by skin, anything which irritates skin. See, like what I said in the beginning is, what is urticaria? Urticaria is when your body is not able to cope up with an allergen. It is sort of an exaggeration of the response of your body.
Right. Rajan Sharma is here asking, is eczema most commonly, does it start in young age or young children before they reach school age? I mean, when the kid is very small, can eczema affect them?
There are this eczema is like urticaria is a huge spectrum. There are various forms of eczema. So that question presented does not pertain to urticaria, but yeah, for the question, I would like to suggest that there are many sorts of eczema which present only in the childhood stage. And there are certain forms of eczema which only present in the adult form. So yeah, there are few eczemas which differ in their age presentation or something.
And I'm sure that one day we'll also have a special session on eczema with Dr. Prateek again. But today we are discussing urticaria. Doctor, I'm sure many patients visit you with this, problem with urticaria. Now, what's the common mistake that you have noticed them to commit? I mean, one I'm sure is that they have taken too long to reach you or consult a dermatologist, because we normally have this tendency to, okay, we will wait and see it will go away with time. It's just related with some seasonal variation, etc., etc. So what are the most common mistakes that you have seen in your patients who come with the issue of this problem?
See, most of these patients with urticaria, the first and the most common mistakes is self-treatment. They get the over-the-counter medications done. They take over-the-counter medications, apply something which gives them a soothing effect, a temporary effect. They tend to use it for prolonged periods of time. Some of my patients start applying the super potent steroids. They present with all the complications of steroids, long-term application of steroids. some even go a step further, start having oral steroids. They present with hypertension, diabetes, all sorts of complication of long-term oral steroids. So first is they get self-treated, they get over-the-counter medications, listen to the neighbors. Social media is a huge platform. There can be misleading or misguiding information there. They tend to take away wrong messages, wrong things from the videos or something else, social media platform. So the most important is they overtreat and self-treat.
Right. So I think that's important to understand that, you'll end up wasting time, you'll end up worsening your condition, you'll end up making the treatment more lengthy because you will reach your doctor only when it's in a very bad shape. So please don't do that. Don't waste your time. If you're seeing anything, any rash, anything that's bothering you, which is not normal, which was not there, please go and consult your dermatologist. We'll pick few more questions from our viewers, Doctor. Ajit Sharma is here asking, what are the complications of urticaria?
Yeah, like I said before, the complications are mostly like you can have breathing difficulties, swelling of the lips, and you can have a deranged lifestyle, social stigma attached to urticaria. So if you are having urticaria, you know you're having some sort of allergy, visit a dermatologist, get it treated at the earliest.
Rashmi Sen is asking a question which we have already addressed, which doctor has already addressed, but still, even if she has joined late, so I'll pick her question. The question is, can urticaria be caused by stress?
Yeah, like I said before, that urticaria, stress can precipitate urticaria. Now, stress doesn't mean it has to be mental. It can be a physical stress, chemical stress, emotional, any form of stress. Going out in the sun, some have solar urticaria. As soon as they go out in the sun, they can have urticarial lesions. Some people have urticaria when they have cold liquids or cold food. So that is a form of a chemical stress. So yes, definitely stress can precipitate urticaria.
Right. Doctor, whenever we get to know that there is some kind of problem with our skin, we normally first go and try something which is readily available at our home, which is the home remedy. We'll go by some dadi ka nuska, nani ka nuska. Does it work in this case?
Most of the times, no. Mm-hmm. These things which are mostly homemade remedies or the over-the-counter medications, they offer you short-term benefit. Like they can reduce the itching, they can reduce the burning sensation or the itchiness, the stinging sensation. But it is better to get yourself treated as soon as possible rather than applying these nuskas.
Okay, and as we are about to conclude this session, Doctor, what would be your message which we can actually take away with us, which we can keep with us, which will completely in sync with? What's that one takeaway message?
See, one takeaway message I have to choose, which I always say to all the urticaria patients: you are the best doctor in this case. You know much more than me. You know what triggers it. You know. Most of the time, you know what triggers it, how you can avoid it. So avoid it. Just avoid it. Do not overtreat. And if you are not able to find the cause, if you're having urticarial lesions for a very long time, visit a dermatologist.
Right. Thank you so very much for that takeaway note and for the whole session. Thank you so very much, Dr. Kumar Prateek, for your valuable time, sir. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they know now that instead of self-medication, it's better to approach a nearby dermatologist. It was great to hear you, and we really look forward for many more such sessions in coming times with you for our viewers.
Sure. Thank you. Thank you so much for this wonderful session. Thank you.
And we would also like to thank our viewers for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day. Goodbye.